to be a woman.
Hello and welcome again to World of Women. Wow, for women, where we aim to bring back values. I am Moji Danisa.
Hello and welcome to this brilliant and beautiful edition of Wow of Women. I am Lucy Ora.
Hello, my name is Ifoma Gift Oladunjoye. Welcome to another episode of my throat. Please don't
What
mind
happened to
me.
your throat this week?
Don't mind me. I had too
You've
much
been shouting
fun
too much.
by the weekend. Yes.
And joining us on the show today, we have a male, a male for women.
A male for women. Yes.
Doctor, yeah, he for she. Dr. Iwowarri Brian James is a consultant energy health practitioner and certified energy health professional. In short, he's an energy psychologist. And he's here today because everything we are going to be discussing today borders on mental ill health. And we're going to be looking at mental ill health and how to seek help, when to seek help. Yeah. You're welcome to the show, sir.
Thank you very much.
Welcome, sir. Good to have you.
I'm glad to be here.
Yes,
Yeah.
a man amongst women. Blessed are you, sir.
Thank you very much.
So you're mostly in Abuja now?
Yes.
Thank God.
Yes.
Yeah. So we are going to be having a lot of therapy sessions and all of that.
Yes.
Energy therapy. I've done it. It works. Most shocking this week was the story of the young, beautiful woman who jumped into the lagoon.
Oh, wow.
From what we learned, it is alleged that she is a DSS official who decided to end it all because her boyfriend allegedly broke up with her. I mean, how much sadder can it get?
This is a woman that, from what I've seen, I've heard online, that she achieved a whole lot. And so because one man said, I don't want again, and you felt it was okay to end it all. Well, the truth is, she's one out of many. This one is because we heard it.
Yeah.
There are so many people in this country, in the world generally. It's not, I don't think it's not only Nigeria that are doing this.
I think for me, really, it's, I don't think it boils down to what we're talking about today, which is mental health.
Yeah.
How would someone take away their life? How would someone commit suicide if not mental health? Like,
Yeah.
I don't know how to describe it. There's no other word to describe it.
For anything, for any reason.
Exactly.
Dr. James.
Yes. Well, we have grouped two things under mental health. There is psychiatric health, there is emotional health. The aspect that we do not talk about so much is the emotional health.
Yes.
And the emotional health, research has shown, contributes 85% of our physical health challenge.
Wow.
Yes. So, well, what is emotional health? It's about the emotional balance, having emotional, mental and emotional hygiene to be able to fit into the society, do what the society expects you to do, with social requirement. Yes. But a lot of us have grown up in certain environments. That's what we call adverse childhood experience.
Okay.
These adverse childhood experiences tend to shape us into what we become in adulthood. And the environment is not friendly to emotional health. We don't even know about it.
Yeah.
We don't talk about it. We don't discuss it. But then we talk about, if you see an onion, the onion has layers. Now there is what we call emotional bank account, which all of us have. Now, what happens is that when emotional challenges come, we push them into emotional bank account. Some people call it dissociation in order for us to move forward, to fit in. Then we have this baggage. What that lady has experienced is not a one-day thing.
No.
It is a cumulative challenge.
Yes.
From disappointment to feeling of shame, maybe she has promoted her relationship so much that people are now looking up to it as a model.
Yes.
And this young man comes and says, no, I no longer want this relationship. She now looks at what will the society say of her, how will she present herself in the public. Not everybody is capable or have built the capacity to manage that kind of emotional fallout. So, and that is why it's important that we, from age 1, we begin to cultivate the power of emotional balance. The moment we have emotional balance, no matter the challenge that confronts us, we will be able to meet it the way it comes.
So how do we do this? Because,
I think we'll get to that. Then
and
let's
also-
still look at the emotional bank or emotional envelope
Yeah.
that will keep everything.
Also,
Yes.
sir, is there a way you can simplify the English? You know, say, it's not everybody that will understand, even this mental health. It's not everybody that actually understand mental health, you know, what it means. So is there a way you can break it down to the layman's language for them to understand?
Mental health is when you are not able to think properly.
Okay.
When you are overwhelmed in your thought process, that you are no longer, you can't imagine you continuing to be whom you are.
Yeah.
You know, it is not mental, like I said, there are two aspects. In the mental health aspect, if you have imbalance in the chemical imbalance in your brain, it could lead to mental health challenge.
Okay.
And some of this imbalance in the brain can come as a result of if you hit your head somewhere, you know, if you had what a concoction.
Yeah.
And you know, when people are growing up in the villages, they used to knock children on their head, which
Like,
which
Kowai.
which is an abuse of the child actually.
That's what they call conk.
Yes, yes, and it can lead to cracks in the skull.
Wow.
That will come out later in life. And when they are looking at the issue, they will not see anything. They will say, except you do a special MRI, you know, or CT scan to check if there are fine cracks. Otherwise, when you have that challenge, there's what we call, there's a liquid in the brain that leaks. You know, when that liquid leaks, it
The cranial
causes,
fluid.
yeah, cranial fluid. It causes problem. Now, that aspect is a different side of mental health. Then there is another one which comes as a result of, you know, focus problem. When the mind and the mind and the body are not integrated.
Yes.
So there is a kind of dissociation. The individual is acting one side, the mind is acting another side.
Is this the one they call ADHD?
So ADHD is attention deficiency hyperactivity disorder. Yeah, all these are mental health issues also because it's in when the child is growing, there is a delay, kind of, in the cognition process within the brain. So, and that person is not able to. We also talk about lack of integration, you know, body, mind, spirit integration. So that is one aspect.
Okay, I guess we'll get back to this because I was going to ask you about PTSD.
Yeah.
In the case of this particular in the case of this particular lady, but we'll take a break now.
Okay.
Yeah, we'll take a break now, sir.
All right.
Suicide is not an option
At all.
but there are underlying reasons, as doctor has said, why people commit suicide, and that is what we will be discussing next. Please stay tuned.
Proud to be a woman. Proud to be a woman.
Thank you so much. The next
Proud to be a woman. Proud to be a woman.
He is still unwell, and we're still discussing mental ill health and when to seek help. Besides spouses turning against each other, we heard about the sad story of a young lady this week, a young lady who stabbed her newborn baby.
Because the mother
Yes,
said
because
so.
the mother said so on the instruction of the mother.
And
Can there
she
be underlying mental, because it's everything mental health? Some people say people hide behind this mental health thing now.
to do evil.
Yes, to do evil. What could be responsible for this one?
Yes, well, it's possible that people hide under mental health to do evil. The act of doing evil does not, it's not part of mental health. Some people are actually wicked, you know, and they can do
Literally wicked,
bad things, yes. But for the woman, you know, there's what we call postpartum depression. When a woman gives birth, the thing is, well, medically there's no explanation as to how that thing comes about. But when we approach it from energy perspective, the energy psychology perspective, we know that the body has been active with something, and every part of the body is living, and suddenly the child goes away. So all part of the body is yearning for the person they are hosting, and there is a confusion in them. So that triggers some psychological reaction, which is yet to be determined empirically in research form, but it's been noted that that affects the woman. So the woman might begin to see the child as an enemy, or see
I've had that experience, doctor. When I had my second son, I had him in the US. So they will tell you, when you feel like throwing away your baby, when you feel like harming your baby, and your baby is, crying, take a step aside. And I'm like, do these people know what they are talking about? Nigerian woman, throw my baby away. It's not possible.
That means that
But then my baby kept on crying, Honestly, I felt like throwing him away.
Okay, yes.
And I remembered what they taught me, and they said, step away. And that's what I did. I stepped away for some minutes, and because at that point, trust me, I was at that verge of
actually trying to
I felt like walking away. I just felt like walking as far as possible as I could.
No, I think that walking away thing, I think it's actually
possibly if I was
normal.
younger, I would have walked away.
I think that walking away is always
so maybe
normal.
this young lady told her mom, the baby is crying, I don't know what to do, and the mother would say, go and kill the child now.
Maybe she should have just said it out of
yes,
go and kill
out
the
of
child
frustration
now,
too.
out of this kind of, some parents used to say, when you tell them, like you tell your mother now, say, where I will drop it, say, come and drop it on my head now. So I'm sure maybe that kind of
literally,
statement.
maybe she took it literally and they carried out the exercise. It is also because of that mental imbalance at that particular point in time, postpartum depression. It is very, it's much among pregnant, people who have young mothers. In one particular case, I got to know the lady was about to strangulate the child.
Oh, Jesus.
The mother came and took the child away, and it happens every time that she has a baby. It's like he said, this baby is too beautiful. My husband is going to not like me anymore because of, and that charge came. Yes.
Okay, but
let's look at energy therapy and what role it plays here.
Yes.
At this point, please, if you want to reach Dr. James, you can call on any of the numbers that are on screen. And for your mental, is it only mental? All the energy therapy. Energy therapy. Because I've seen it work with someone, a soldier who went to war and had PTSD. I was there the day Dr. James started his therapy. And it was something else. It was wonderful. It was amazing.
Dr. James,
Let's
let's
quickly talk about PTSD because you mentioned it.
Yes.
PTSD, the full name is post-traumatic stress disorder. And it happens when you have gone through a traumatic experience and you didn't seek solution for that trauma at that particular point in time. So it grows into post-traumatic stress disorder, maybe within the first 6 months, 6 weeks, to another 6 weeks, another until 6 months, until 1 year, you have not done anything about the experiences. And what those experiences, they are negative charges that you have accumulated into your system. The body reacts to those negative charges. They are energetic, and you are supposed to desensitize them. in your system. But if you don't desensitize them, they will be growing because it's energy. And when they come to that level, they create a lot of problem for you. As you're walking, you think that somebody is following you. You get startled. You have nightmares of that experiences. You will not having mental balance, in quote. You will not be able to think straight. So decision making, if you operate executive, if you are in charge of taking care of people, becomes impaired. So there's a lot of challenges associated with that post-traumatic stress disorder. And like I said earlier, there's accumulated trauma, emotional trauma that is not taken care of. When it gets to a peak, you know, if you are drawing catapult in those days in the village, at a point the catapult will snap. So when it gets to its elastic limit, you will now act as if you have been mad all along. But then you were not. The only reason is that the emotional health challenge that you experienced was not taken care of. And that is, it's important that anytime anything happens, seek help to clear that thing at that particular time. Physically, when you have a cut, you go and treat it. If you don't, it will decay until you amputate the hand. It is the same thing with emotional health issues. If you don't treat them, they will grow and become a big issue. And you know one bad thing about emotional trauma. If it is not resolved, it can enter into your body tissues and gets encoded in the genes. And as a woman, you can transfer it to future generations.
Oh, really? You can transfer trauma?
Yes. So unborn children come already traumatized. So that is the danger in it.
Doctor, let's take a break. Let's take a break now, because this is another angle that we have to look at, because you see the younger generation today and you wonder, what is happening to them? What is this? Is everybody run mad? Is everybody depressed?
The foundation is...
We don't know. We don't know. We could even be passing it on. I will be back. Stay tuned.
Proud to be a woman. Proud to be a woman.
FCT, Kogi, and
Proud to be a woman. Proud to be a woman.
It's still on World of Women, and we're discussing mental health mental ill health, and when to seek help. By the way, I'm a little under the weather too. I have flu, and I've been using the energy therapy to keep to keep the cough away. Yeah, to keep the cough away.
You have plenty of us to treat you.
That's why I'm in Abuja to support Abuja.
Okay, Doc, just a quick one. I wanted to find out, because you know, when you talk of mental health, the one that a lot of us hear about on daily basis is depression, right? It's the most common around, even though I'm sure we have other ones, but this is the one that you always hear people on social media, I'm depressed.
Even children.
Yes, even children.
More and more
so I'm trying
things.
to understand, like, why do you think this is common in our communities and society?
Especially amongst the youth.
Amongst the children.
There is a lot of pressure in the society today. If you look at what is happening, there's a lot that is happening that is stressing people. You know, we talked about PTSD, we talk about the ACE, Advanced Childhood Experiences, which is common everywhere. Parents are fighting in their homes, children are soaking those things, people are behaving anyhow, children are soaking them. And of course, we talked about transferred trauma, which the mother has transferred to the child, you know, while even as an unborn child coming out. So all these are in totality what is affecting the people. Now, the society also needs to mold itself to help the children coming up. You know, like we talk about mental health, emotional health, which is very important, I said earlier, contributing to 85% of our physical health challenges, is not being given attention. We talk about energy therapy to school program, where we try to help dysfunctional children coming from dysfunctional homes, you know, into the school society that turn into bullies. And so when the child is incapable of withstanding emotional harassment, then he or she start thinking of an escape route. The escape route can be drugs, can be sex, can be any alcohol, can now be suicide. So but if we take into consideration these challenges and mold our educational system, support the help, that the solutions that we are bringing now into the society to help the children, a lot of stability will be gained. It is lack of emotional stability that is giving rise to all these conditions.
Okay. If, for example, we know someone who has mental, because you really cannot say, I think I have been affected by too much social media exposure, which has caused me a lot of PTSD. I have a lot of issues in that. When do we seek help, really?
Anytime you think that something is wrong within you, I talk about stress as your internal reaction within the space between your expectation and your reality. When you think you can't manage that situation well, seek for help. If you also observe somebody who is not managing that space, managing himself or herself well within that space, encourage the person to seek for help.
But sir, there's another thing that is that's even another problem. So you say seek for help, and some people will say, okay, they want to speak to somebody about it. But you get to find out that some of the people they speak to, the religious people and other people they speak to, tend to become assistant Jesus Christ. You know, they get to become judgmental. And this has made most of these youth, I'm speaking for the youth because I speak to them every time. This has made some of these youth clog back to that shell that they cannot speak to anybody. They don't trust anybody to speak to.
Doctor,
how do they come out of
let's
this?
take that. Let's take that.
You need to find somebody who is a professional in that area. The pastor is not a professional in emotional health issues. I want to look at emotional health more specifically because it is the driver that can go up to mental health challenge. Now, but that is what you can also start at the rudimentary level to help the individual to deal with. Somebody has gone to war, comes back. There are issues that he has to deal with them. Somebody has gotten married. There are things that he or she is expecting are not what is happening. You should seek for help. You shouldn't go and tell pastor or tell bishop that this and that. You should seek for professional help. You know, you have a child and that child is not turning out the way you want it. Seek for help. What can I do for myself and for the child?
Can we quickly look at the signs the signs to look out for?
The signs are many, but then it depends on the particular issue and the particular environment. Like I said, if things are not happening the way you expect them, if you are not happy, if you are sad, sadness is one of the signs of you are unhappiness, is the feeling frustrated, you have negative reactions to certain situations. You feel overwhelmed, that this thing you cannot handle it. Seek for help. We use energy therapy now. Somebody will say, seek for help is generic. But we have energy therapy that we can use.
We'll call you back on this show. If you want to, like we said, if you want to reach Dr. James, please call or any of the numbers that showed on your screen. Anyone can snap or break under pressure. When we notice someone acting out of character, as Doctor has said, please, we must advise the person to seek counseling or therapy. And Dr. James is here. We'll be back same time next week. I am Muji Danisa.
I am Lucy Ora. It's glad to have you today.
I am Ifeoma Gift Oladojoye. Parents, please stop conking your children. Biko.
Thank you very
See
much
you
for
next
being on
week.
the show, sir.
Thank
Thank
you.
you.
Sir.
Thank you.
Yes, so
Thank you very
interesting.
much. Yeah, I'm excited to be
So
here.
really endless.
Thanks for
like,
having me.
See me, I just sat. I was just listening to you.
I'm coming for therapy.
I didn't want
Yes,
to
that
put
will
you
be
short
fine.
in any of the discussions.
You've already
It's
have
almost
one.
like
You already have
endless.
one patient.
Yes, I also do therapy over the phone. So
I am
you
coming.
don't
Don't
even
worry.
need to see me face to
Don't
face.
worry. I am. In fact, I'm calling you already.
Bayelsa State, the glory of all lands. First position, traditional cuisine, goes to Bayelsa State, the glory of all lands.
Bayelsa
Let's
State.
appreciate Bayelsa State.
We need to know what they